Hi, this is Unit 19, Health Promotion by Ruth Triner. Health promotion is a technique to assist the public in focusing on the individual's health and their family's health in the present and future. Communities in our nation can face health concerns at some point in their lives, and health promotion is a structured mechanism to enable governments and communities to create positive health policies and helpful environments to empower action and information regarding health as part of the nation and personally. The first health model is the health belief model. It's a theory implemented from behavioural sciences to help health issues. It is widely accepted conceptual framework regarding health behaviour. This began in the 50s, where health check standards were in small numbers. This model assumption is when individuals feel concerned over a particular health issue, they decide to implement a change to prevent or treat the health problem. However, if the behavioural change seems to be challenging or at risk is small, the action to prevent a health concern may be aborted. Self-efficiency is a confidence to achieve a behavioural change, such as changing attitude towards a health concern and implementing a goal of prevention towards a health issue successfully. This was a change added in the model later on. This is a diagram of the elements. Social cognitive theory, or SCT, explores a dynamic between personal factors, behaviours and environment. There are three dynamics interlinking by influence amongst each other. This is called reciprocal determination. And this is another diagram. So modelling is an example. If a child observes their parents presenting a positive life skill, such as washing the dishes, the child will absorb and remember this behaviour and perform self-efficiency to reenact this behaviour themselves. The next one is Stages of Change Trans-Theoretical Model. This model was created by Prochaska and Di Clemente during the 1970s to help examine people who were in the pursuit of quitting nicotine addiction. When individuals stop smoking, it may not last in the long term. So there's 5 stages created to help individuals to achieve goals, stick to positive behaviour change. This model is designed to help the individual to believe in change and themselves first. If there is any doubt, the strength of changing the addictive behaviour, prevention of addiction, can fail in the beginning of this model. So there's 5 stages. So this is the diagram. So stage 1, pre-contemplation. This is the early stage of doubt, and the individual may seek to find reasons not to change at first. This could take a lot of time to begin a new behaviour change. Step 2, contemplation. Contemplation stage will manifest by an individual weighing up the positives and negatives in change. For example, smoking can give you cancer, but smoking can also relax and help in stressful situations. This stage can also take a lot of time. When the individual is ready to move on to the next stage, they will gain confidence to consider how the pros and cons will affect their life, passing barriers and looking at the positives of change. Step 3. Step 3, preparation. This stage is about testing the waters, such as looking into forms of prevention in smoking, such as type of nicotine products, or seeking medical professional help to look at options. An individual at this stage will take the time to look for strategies such as support groups, action plans and meditation. So stage 4, action. This stage can last for 3 to 6 months. This stage is also strenuous and painful time. An individual may feel obstacles are too hard to overcome and worry about relapse. But with support from loved ones, this can really help. So stage 5. Stage 5 is maintenance. Maintaining behaviour change would sustain for 6 months. Relapse is still possible, but confidence in escaping bad habits is sustained. Temptation is still possible, but avoiding smoking becomes a normal part of life. And becoming honest with themselves is vital if relapse occurs, and communication with supporters on possible relapse. Stage 6, relapse. This can happen next month to 6 years from now. A slip up in behaviour can cause enormous guilt and shame, but looking into triggers can be positive. Reconfirming the commitment to behaviour change, remembering what has been learnt in the past 3 stages, can keep an individual on a positive pathway. Comparisons. Comparing the models. So the health belief model and trans-theoretical model both focus on health behaviours, individual confidence and the ability to change this. The HBM looks into cognitive processes an individual will go through while considering their health, but not the emotional impact on their health behaviour. The TTM analysis the behavioural aspect of change and considers the stages of readiness and awareness and promotes internal belief. Both models promote self-awareness to be self-efficient when considering health change. HBM considers risks involved in behaviour change, where TTM promotes readiness for behaviour change. So the effect. The effectiveness of health models can vary due to factors involved. So implementation, the model applied, target population, the context. For a model to be effective, the model should be research and evidence-based. This will create a higher rate of success in promoting health change. Personally, making the model personal to an individual can achieve better results. Behaviour techniques, becoming self-sufficient, setting goal achievements and receiving social support can gain positive results. Health promotion that is effective needs to have longevity, not short-term fixes. Monitoring behaviour models to see if improvements are needed on receipt of feedback can improve health models in the future. So, how did TTM and HBM affect? So TTM had helped maintain behaviour changes in smoking prevention, weight management, physical activity promoting by individuals by gaining confidence in self-efficiency in behaviour change. The health belief model successfully implemented higher results in breast cancer screenings in individuals and promoting self-efficiency in physical activity, finding individuals keeping up good habits for long periods of time. The aims and objectives of health promotion. Change for Life was highly successful government health promotion, targeting families with young children to promote healthy eating. Back in 2009, it was the UK's first social marketing initiative to help families consider healthy eating strategies to prevent child obesity. With public health growing concerned for the rise in child obesity, Change for Life is a colourful interactive initiative to involve family units in taking health life choices. The age bracket is 5 to 11 years. The 4 stages of success. So it was split into 4 stages. The first one was alert, by reaching out to families with the message of impact too much sugar in the diet can cause weight gain through advertising. motivating families to get involved through education in advertising and school promotion, making it valid to the target audience. Support Change for Life introduced a mobile app called Sugar Smart to get the audience's attention with a free, fun app to support in the education of high sugar. Sustain Making families aware of high sugar in the food industry, in particular in cereals, their children will eat, asking parents to make educational choices in lowering children's sugar consumption. Change for Life success. So Change for Life success was astonishing with 99% target audience engagement, over 400,000 families joining in the first year, and after 6 months, 400,000 families still engaging in Change for Life. And family engagement reaching 1.9 million in 12 months. Change for Life introduced catchy life hacks to encourage families to eat better, such as 5 a day recipes to hide fruit and veg for picky eaters. Another healthy habit could be eating snacks at only 100 calories twice a day to encourage healthy snacking, or swapping out sugary foods with healthy alternatives by using the Food Scanner app to educate on the amount of sugar in foods. In 2010, the second year of promotion, Start for Life began publishing information for families with young children and moving on to a programme for adults in middle age. The NHS improving public health. So the NHS provides healthcare services to our nation with hospital care, health promotion campaigns, vaccinations, primary care screening throughout the country, such as COVID-19 vaccinations, serving by providing appointments during the COVID pandemic, mass walk-ins to vaccination and screening for COVID-19. So, NHS England provide programmes to prevent illness and disease. This initiative belongs to the NHS Long-Term Plan. NHS England looks into tackling health inequalities by prioritising people from deprived backgrounds due to long-term health complaints. It's more prevalent. NHS England ran the following health initiatives. So the initiatives were obesity, alcohol dependency, smoking tobacco, HIV prevention, tuberculosis, antimicrobial resistance, cancer prevention, and many more. The NHS Long-Term Plan aims to support the nation to live longer, to choose healthier lifestyles, and to treat avoidable illnesses earlier on. The NHS Long-Term Plan is facing its 80th birthday. With concerns with inequalities in growing aged population, funding and staffing pressures, NHS England's have optimism in advancing better outcomes of care, with 3.4% on average a year on the next 5 years of funding compared to 2% over the past 5 years. Secondly, NHS Long-Term Plan, there has been a wide consensus on changes needed confirmed by patient groups, NHS leaders and professional bodies shaping the long-term plan through 200 separate events, insights offered by members of the public at 85,000 and organisations representing by 3.5 million. NHS Long-Term Plan is focusing on a new service model to improve support optimal care by providing 400 million face-to-face appointments each year over the next 5 years. Patients will receive digital GP consultations. NHS will save 1 billion a year in saving patient trips to hospital and outpatient appointments. GP practices will receive funding to work with communities' social care staff to expand community health teams. under national standards supporting people in their homes to prevent hospital visits. The refunds will be backed by a new guarantee for the next 5 years investment in primary, medical and community services, growing faster than NHS budget. The long-term plan is funding new evidence-based by NHS prevention programmes in smoking, reduce obesity, preventing type 2 diabetes, alcohol-induced A&E visits. The long-term plan wants to tackle health inequalities with 5-year funding allocated to local areas to receive more accurate assessments of health inequalities and unmet needs, including mental health, learning disabilities, autism, homelessness, providing outreach support. So the NHS long-term plan is covering funding concerning inequalities, community outreach, public opinion, disease prevention, better patient access, including a 5-year goal plan. Thank you very much for listening.